Foods that can lower your blood pressure. That is right, guys. I want you to listen up. You guys are always asking me for ways that you can lower your blood pressure naturally. Here are some foods that literally can do it. I'm going to give you 3 groups of foods. You want to stick with me to the end of the video because the last one I'm going to mention, I know you probably would have never thought. And by the way, it's a little surprising to me. So let's start out, okay? Let's start out with a category of foods that's part of the DASH diet. DASH. That's called Dietary Approaches to Stop Hypertension. In fact, I have videos just on the DASH diet. It is that important because this diet not only can help lower your blood pressure, but it can also help reduce your waistline. Check out the other videos I have on the DASH diet, but let me give you an idea of some of the foods that are within it. We're talking fruits, veggies, low-fat dairy, lean protein, that's like fish, chicken with the skin off, things like that. Also nuts and legumes, that's beans. Non-tropical vegetable oils, very important. I have a video on on cooking oils, not the tropical ones, things like coconut oil and stuff. Stay away from that. The non-tropical vegetable oils. So those are some of the foods that are part of the DASH diet, kind of sticking to like this Mediterranean diet or so. The other part of that is minimizing things like, of course, alcohol. Alcohol by itself, if you drink too much, can increase blood pressure. Avoiding and minimizing sugary foods, added sugars, also minimizing sodium or salt. We've talked about that. And it's not just about using the salt shaker, because a lot of my patients and people are like, I don't use the salt shaker. And I believe you, you probably don't. But a lot of times it's the package and prepare foods that we are buying, that we are eating, that we are grabbing and going, grab and go. Those foods often have a lot of sodium and foods with a lot of saturated and trans fats, also some of the high, the fatty meats and things like that. So the first category, which again, I'm so excited to be talking about this topic because I probably should have done it a long time ago, but I'm really happy to be doing it now. The DASH diet. Check out my other videos on that. Take a look at it online. It is a diet that we doctors love, okay? And ask your doctor about it. Make sure they're cool with it, but I can pretty much guarantee that they're going to love it, okay? The second category of foods, and by the way, I should tell you, all of this stuff you need to run by your doctor. I cannot tell you what you need to do, only your doctor, and you can decide that, okay? So run all of this by your doctor. The second category of foods that can help lower your blood pressure are potassium-rich foods. That's right. Foods with a decent amount of potassium in them, right? And you're probably saying, well, what does potassium have to do with my blood pressure? Well, it does a few things, okay? It sort of works with sodium. It sort of plays off of sodium a little bit. And that's one of the ways that it deals with blood pressure is it sort of, alters and sort of affects sodium, etc. Also, it can affect the blood vessel walls. There are other ways that it can sort of help lower our blood pressure, but potassium-rich foods can help lower our blood pressure, okay? So you're saying, all right, well, what is that? Give me those, Dr. Jen, and I got you, boo, I got you. All right, it's green leafy vegetables, green things, broccoli, spinach, other leafy greens, love, 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 okay? Kale, love that. So your leafy green things. And also what's really great about those is that they're low in calories, right? They have other nutrients too, by the way. They've got potassium, they've got other things too, which is great. But also we've got other veggies. So beans, lentils, tomatoes, I'm reading from my list, so please pardon me. Potatoes, sweet potatoes. I tend to be like a regular potato girl. And with the skin tends to be even better for potassium than without the skin, but sweet potatoes as well, if you like the sweet potatoes. Let's see here. Also fruits as well. So bananas. I think a lot of people, when they think of bananas, they think of potassium. Not a bad thought, right? Also things like kiwi and other fruits as well. So there's a wide range of foods, right, that have a good amount of potassium. And consuming potassium-rich foods can help potentially lower your blood pressure. Now, let me give you some caveats before you run out to the store and throw every potassium-rich food you can find in your cart and start eating them all. Let me give you some caveats, okay? You can consume, you can take in, you can have too much potassium in your body, and that actually can be dangerous. And the likelihood of developing or getting too much potassium in your body is dependent on a number of things. Maybe what other medications you're taking. Are you on certain blood pressure medicines that can also increase your potassium? Your underlying conditions. Are you on dialysis, where maybe potassium balance is always, something we're worried about anyway? Are you on a potassium restricted diet for that reason or others? Do you have kidney problems otherwise? Do you have other underlying medical conditions? This is what I would say. Before you go out and say, I'm going to lower my potassium, one of the ways I'm going to do it is one of the ways that Dr. Jen said, also the Googler Schmoogler, because it's all over there. I'm going to start a potassium-rich diet. Before you do that, you actually have to ask your doctor if you can sort of take in more potassium-rich foods than you're already doing. Okay, you've got to make sure it's okay, because there are many of you out there that really should not be eating or loading up on potassium-rich foods, and it's possible to overdo it. Okay, this is not carte blanche to go out and start eating every banana you can find because you're going to lower your blood pressure that way. No, 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 no. You're going to cause other problems. Okay, so I need to say that. The other thing I would say too is that, like with the green leafy vegetables and stuff like that, and other foods, right? If you're on like blood thinners or you're on other medications where you have to be careful of your diet, do not throw those rules and instructions you've already been given out the window. These are just sort of basic pillars of information for you then to go to your doctor and say, hey, I learned that potassium-rich foods can help lower my blood pressure. Is that something I can start doing? How much? How often? How? What? When? Where? Why? That kind of thing, okay? You got me? You got me? Okay. Now for the final food that, honestly, guys, this I think is so interesting, okay? And there's actually data behind this. Believe it or not. And by the way, I also think it's like the least likely vegetable that can help your blood pressure. But it is, drum roll please, beet juice. Yeah, beet juice. Like juice from beets. Beet juice. Yeah. The purple stuff, the purple beets, the purple beet juice. There is some data to support the idea that drinking a certain amount of beet juice can help lower your blood pressure. That is right. So again, is this a sort of a carte blanche invitation to go out and drink all the beet juice you can find and drink it all day, every day? No, 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 no. And also check with your doctor about this too. But if you want to throw in a little beet juice every now and then, maybe it's something worth a try. Just, of course, check with your doctor. Guys, I hope this is helpful. I hope you guys sort of really think about these things. Again, like the Mediterranean, the DASH diet. I said Mediterranean, but there are some overlaps. The DASH diet is a really amazing diet. It really, really is. Like I said, it can help your waistline in addition to helping your salt intake and things like that. Make sure you check it out. Pass this video to anyone who you think it might be helpful for. Talk to your doctor about these things and run it by your doctor to make sure it makes sense for you. Please, on Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. I do daily videos. I'm on TikTok and Instagram as well at Dr. Jen Caudle. Also, sign up for my free health newsletter. I don't know why I'm tongue-tied. I'm at the end of the video. Please sign up for my free health newsletter at drjencaudle.com. Guys, I'm Dr. Jen. It is so awesome to be with you. And let me know how you do and share this video with anyone you think it might be helpful for. All right, guys. Oh, and comment below. All right. Let me know what you think of it. Okay. All righty. Bye.